My tattoo was my birthday present to myself. It is Jace's unrepaired heartbeat, which means a lot to me because that's the heartbeat that I know. My husband and I have been married 14 years. My daughter, Piper, and my son, Charlie, are about 3.5 years apart. After Charlie was born, he was 1. We started trying again. We did a whole year of fertility meds. We had the option to keep going, and we kind of chose to just be satisfied with our family, how it was. And in the midst of all of that, very surprisingly, found out we were pregnant. After we found out we were pregnant, about a week later, we found out we were having twins. And then at 16 weeks, we found out they had twin-to-twin transfusions. Once they were born, they were both in the NICU, and we found out that they both have heart issues. Typical preemie things that they said will probably close on their own, and Parker's did start to close. Jace, however, the VSD that he had was very large. We found out that he has mosaic Down syndrome, and at that point the doctor told us that the hole in his heart would definitely not close.
Jace has a very common congenital heart defect called ventricular septal defect. What's a little bit different about Jace is that he had a very large one, so we had to do a palliative operation. It served him well, allowed him to have control of some of his heart failure symptoms. However, he was not able to leave the hospital, had feeding problems, and we eventually had to do the entire repair at around 3 months of age.
Dr. Reamson came in and was very confident and very reassuring, and this is a simple procedure and he's going to come out of it great, and he was very reassuring. He came off of bypass the first try. He was only on it for about 20 minutes, which I've heard around the halls that that's kind of amazing because that's a very short, fast time. Once the surgery was over, he came in and was just thrilled at how well Jace did.
We are very fortunate as Arkansans to have one of the best hospitals in the world right in our backyard. We round every day as a multidisciplinary team. So we go see every child that's about to have surgery or has had surgery that's in the hospital. Allows us to really focus on getting these children home with their parents safely.
They can escalate very quickly within a matter of seconds sometimes. So to have a hospital up there that will have an emergency room for things like he may just need some extra oxygen for a few hours and then he can go home is really reassuring for us that we won't have another trip here and be here for another couple of weeks, that it could literally just be a couple hours or a respiratory treatment or something quick. Now that his heartbeat has changed because of surgery and being repaired, I felt like it was important for me to remember that broken heartbeat. And so I get to look at that every day now. And eventually I'll add his repaired heartbeat on the other side, but for now, it's just my reminder of how far we've come.